Welcome back to the NHSC site application process. Today, we're going to talk about the substance use disorder opt-in documentation. As always, everything we talk about today can be found on HRSA's website, the National Health Service Corps section, and everything I reference can be found in the NHSC site reference guide. So please read that reference guide before submitting your NHSC site application. So this substance use disorder opt-in documentation is not required for the application process, but if your site does offer any of these substance use or addiction counseling, psychosocial services, then you must submit the substance use disorder opt-in documentation. So you must submit one of the following. So substance use disorder operating certificate issued by the state, territory, county, or a site brochure listing the on-site substance use disorder services, or a site policy that outlines the on-site substance use disorder services, or a document that includes the website link and screenshot of available on-site substance use disorder services, or other documentation that outlines on-site substance use disorder services provided on-site. So one of those documentation must be submitted. Another form of documentation that must also be submitted on top of that previous documentation we talked about in the last slide is medications for opioid use disorder services. So this is a letter that must come from the site CEO or the medical director. And basically in that letter, it must state that the site offers medication for opioid use disorders on site, the days and hours when the site offers medication for these opioid use disorder services, and the size of the medications for opioid use disorder patient panel for the most recent 6-month reporting period for which data is available. So including all of that within that letter. And this is an example of the letter template. You can use this, when creating your letter for your medical director or your CEO, but this is kind of the format that you use. And again, with those 3 major requirements talked about in the last slide. And you will also upload this as well. So who submits an SUD opt-in? Those that are exempt are FQHCs, FQHC lookalikes, Indian Health Service facilities, federal or state prisons, and then ICE facilities, and the Substance Abuse and Mental Health Services Administration certified opioid treatment programs. So they don't need to submit for the NHSC application, but there needs to be some type of documentation on hand. So again, going back to those, those policy forms or some type of brochure explaining those substance use disorder services and treatment, there needs to be some form of documentation that on site. So if HRSA does visit for a site visit or request it, you have that documentation ready to go. If your facility is not listed, then you are not exempt. You must submit the SUD opt-in letter and one of those documentations. But again, it's only if your office, your site, organization offers this substance use disorder treatment. If it doesn't, you do not need to submit. It's not a requirement. But if you do offer it, then you would need to have all of those required documentation submitted with your NHSC site application. As always, if you have any questions, feel free to email me.